Hi, my name's Albert Ray and I suffer from cystic fibrosis.
Hi there, I'm Stuart. I'm one of the physiotherapists working with the cystic fibrosis team. I've been here since April of this year, so around 8 months time.
Some of the personal problems I find with CF is I find it really hard to gain weight. As you can see, I'm really slim. I find this is probably the hardest part that I find to deal with CF. Also affects, I'm quite an open guy and quite out there. I'm not that shy, but when it comes to body image, I can get quite self-conscious, surprising probably to a lot of my friends. My CF varies massively from day to day. Sometimes I can get up and I can feel fine. I feel as normal as a cystic fibrosis patient can feel. There's other days when my chest is ridiculously tight, my airways just feel so blocked and I feel weak, tired, my chest is full of mucus. And it's even harder to breathe than usual and you just have no motivation to do anything, which is really tough. You lose your appetite, which for me, considering I find it hard to put on weight as it is not the best.
Physiotherapy consists of assisting patients with their airway clearance techniques. So that involves teaching patients and helping them with clear their secretions from their chest, so the mucus on their chest. There can be varying different techniques to clear their airways. One in particular, we use a term called autogenic drainage, which by the way we teach patients to breathe at a certain level of their lungs and try and what they call unstick, collect and then evacuate the sputum. So try and move if there's any sputum lower down, try and move it up to clear it out.
I can line up back.
You leave it further down there, that's fine. Just make a big touch. Want to drink it in?
No,
Sure. Fine. Right, same idea. Take some nice breaths. The base of your lungs and out. Sit up a wee bit. Okay, need to wriggle back a wee bit. Right. Alright. Some easy breaths in again. Feel alright? Hold. 2, 3. You want to try a huff? Okay, so you got these in the car. Yeah?
I can get coughing up.
Yeah, okay.
I'm gonna try it anyway.
Okay. Done?
Yeah.
They can get manual assistance with this, but they are encouraged to do this daily themselves. There's different adjuncts we can add into that. There's some devices they can use to give some positive pressure to loosen secretions and also help prevent wheeze when they're clearing their secretions. We're lucky enough to have use of a bit of equipment called the vest. We use a lot of that in inpatients and in outpatients. Okay, where do I go there? So this inflates and deflates, so you get some high frequency chest wall oscillations. With your AD, you can practice your expiration, your breath out. Let's see if you can hear some of that sputum that may be in your chest through the shuffle. Try to stand up. So working in CF and treating these patients is something very different to what I've done before. You're coming into quite a small team that all the patients kind of tend to know. So you've got consultants, nurses, physios, dietitians, psychologists. So it works both ways. It takes you a while to get to know the patient. The treatment times can be quite. You can be with patients for a long time. Quite intense treatment sessions.
This is on average the amount of pills I take in a day. Some for helping me digest my food because my body can't do it properly and it won't take in the vitamins. I have vitamin tablets to help keep up my vitamin levels in my body. I also have an antibiotic which I take 3 times a week, which is very strong to help keep the bugs at bay, which could be lingering in my lungs and anywhere else in my body, which is affected by my cystic fibrosis. This is me using my nebulized inhaler. It takes roughly 5 minutes at a time, and then I do the physio treatment to help remove the mucus from my lungs. Cystic fibrosis can be a very stressful illness when you're surrounded by people who don't have it. I'm the only one in my whole family which has it. I have a few friends which do suffer from the illness as well, but I'm currently living away from home, so I don't get to have that contact with them and have someone there who's suffering the same. Although with technology we have today, I can contact them online and via phone, but still it's not the same. Sometimes it can be a bit tougher having someone who just can't fully understand what you're going through, especially the days when you're feeling really down and your health's really bad, which happens on a regular basis, especially in the winter.
Treatments for Albert that I think work best that we've seen so far. I think Albert works well when you can physically or visually see the effect of a treatment. So we tried to combine a wee bit of the airway clearance techniques, so just the breathing exercises, which on their own are very important and need to be done. But I think once we added in bits and pieces of equipment like the vest we've talked about, I think combining those 2 treatments and letting Albert see how much stuff was on his chest, once we were able to clear it, maybe how kind of the benefits afterwards, how good he felt afterwards. We've tried as well giving bits of advice about general kind of exercise and the importance of exercise and combination kind of with your airway clearance technique, and that's stuff he's taken on board, and even just day to day keeping active at work, at uni, it's all important. And the other thing we found as well, sometimes nebulizers. Albert's gone home with a saline type nebulizer. So again, something we've seen the benefit of while I was here, to sort of help loosen secretions and keep them loose. So yeah.
With CF, there's a lot of loss sometimes due to the condition. Sometimes you lose friends and or family in some cases. It's like any loss, it's hard to deal with. Personally, I've lost 4 friends to the illness, and maximum age of 22. It's tough to deal with, but you've just got to remember they'd want you to keep going and, as they say, breathe easy.
In my view, on CF, or the people who suffer CF, can have a lot of respect for these people, and the way they have to deal with a chronic illness, really. The way, as I mentioned before, the way a lot of people balance work, uni, college, social lives, with a whole host of what people can be on, huge amounts of medications, have to dedicate time to clear their chest, and then you put myself in their shoes, and all I have to do in the morning is get myself up and get myself into work on time. For a CF patient, their daily lives probably start an hour, 2 hours before the rest of us are up and about, because they're thinking on medications, they're thinking on physio, and then that's just the morning. They've got to carry that on through the day. So a lot of respect for them.
I myself, as a personal sufferer of CF, I tend to play it down. I don't like to make people feel a lot of sympathy for me, which could also be my downfall, because for most of my friends, they don't then tend to realise how bad CF can affect me. I tend to just play it down as me being lazy or me just not wanting to do anything, which is a massive downfall for me, because my friends don't fully realise how much my CF is actually affecting my life. Seems okay at first, doesn't it? Maybe even fun, but keep going for the next 30. After a few seconds, your lungs start to strain, your head aches, and your palms begin to sweat. Remember, you can stop when you've had enough, but people with cystic fibrosis can't. That's you at 45 now. It's how they live every day. For people with cystic fibrosis, struggling for breath is a daily reality. Their lungs fill with thick mucus, they struggle for every breath. It's almost like drowning on the inside. To experience what that's like, pinch your nostrils shut and breathe through the straw for 60 seconds. Then imagine living every day like that. Most people with cystic fibrosis die simply because they can no longer breathe. That's your first 60 seconds done.
So the only it's a difficult one, because even when patients maybe come onto the ward here, generally they're younger patients from the outside, from someone that wasn't involved in their care. They look young, and they may not be on kind of oxygen necessarily, and so to the outside they do look well. But I would suggest that anybody that was anywhere near involved in their treatment or care, as soon as they opened their case notes, or look and see how many medications they're on, or indeed look to see how much other problems they have in terms of their chest or their gut problems. So I think from the outset, I think it would be easy to think somebody's not unwell. But I think as soon as you know anything about their condition or their care, then it's soon apparent that these patients are battling a disease every day, and just trying to keep themselves well.